love being able to play a part in saving the lives of so many babies. I know this is such a difficult time for our families, and nobody wants to come to the NICU when they're having a baby. So just being able to support them, trying to make the situation a little bit easier for them. The Journey Bee program is a free program that we offer to our families. It was sponsored by Cottie Cake. We have a bead that represents, any kind of milestone that the baby has gone through. So we have a bead for, the first diaper change, or the first time the baby ate, or, the first time mom held the baby. And it just, in such a difficult environment, to see, successes. Sometimes our babies, take a step forward and 2 steps back. We feel like it's very important for moms to celebrate the positive things and see some of the positive things during such a difficult time.
So we were expecting twin boys, Blake and Burke, and Blake's sac ruptured at 17 weeks, and we did have early notice that we would need the NICU. The care that Blake and Burke received was just phenomenal. You can look back, even though the journey was very hard, and we have no regrets. We know that the care they received was the best, and the doctors and medical staff, they poured their hearts and souls into our boys, and we love that. And it brings comfort knowing that even though Blake is no longer here with us, that he received the best medical care possible, and that everything that could be done was done for him. And that's comforting as a parent, just to know that there's nothing that you missed.
So we probably used the sleep rooms more than most families here. I think we spent 5 nights and a couple of days, partial days in the sleep rooms. When we were here, they were pretty stark. It was sufficient, but it was, the bare necessities. Seeing the appointments now and how nice the furniture is, to see a real bed, so that you can actually get sleep when you're already at the ragged edge of exhaustion. That's important.
When we were fairly early on in seeing Dr. Stevenson, her very keen eye identified that there was something that didn't look quite right on our ultrasound. And we kept an eye on it for a month or so, when it was determined that we needed to seek additional diagnostics to really confirm what was going on. And at that point in time, we had an MRI which confirmed that Elle, who was twin A, had an issue with her intestines, which thankfully we didn't need to do anything about immediately, but would require surgery as soon as she was born.
The Cottie Cake Fund has been a huge supporter of the Charlotte Fetal Care Center, and I've provided a number of different pieces of equipment that are vital to our program.
The NICU couldn't function as it does without the support of the community, and it makes a real difference in the lives of the people who are experiencing it. The bedside cameras are an example of one of those things that the Cottie Cake Fund provides, and as a parent, we have an incredibly busy household. We couldn't always be here, and it was so nice to be able to check in on her. We knew that she was healthy and safe and all of those things, but it's just good to see her when we couldn't physically be here, and that's one of the many things that this community has helped support in the philanthropy.
Philanthropy has played a major part in the care of our patients, and how the families are able to participate in the care of those children. So one of the newest therapies that we have available is something called therapeutic hypothermia, or what we generally call a cooling therapy. It's with a cooling blanket that helps to lower the infant's body temperature to help interrupt an injury process that goes along with an insult or an injury that happens right around delivery. And it's a therapy that is only here at Levine Children's Hospital, at least the only one in the region.
The Hampton and Russ family have given back so much to our program, it's hard to even put into words the depth of gratitude that we feel for all that they've contributed to our program and all the lives that they've touched through us, and it wouldn't have been possible without their support.
We started the Cottie Cake Fund as our way of giving back to the NICU for taking such good care of Scotty. We were just overwhelmed with how wonderful they were, and so when we were in the NICU, we decided that we certainly wanted to do something to let them know how thankful we were for everything that they had done. And then from there, it kind of grew into really a way of making sense of it all. I think that the fund helps us be at peace with what happened in losing Kate. We would like to thank all of our donors who have been with us for the last 7 years, to the donors that have joined us this year, our in-kind donors, our steering committee, and everybody who's made the NIC of Time grow to where it is today. We thank you so much.
We would also like to thank the doctors, the nurses, the PAs for their wonderful care, and for Levine Children's Hospital for making these miracles happen every day. Thank you.